Hello, my name is Tammy Banks, and I'm actually really excited about the topic for my clinical integration paper. It is based on the birth of a new area in Lake Cumberland Regional Hospital, and I was there for the whole beginning of it. And it's based on something that emergency rooms all across the nation, all across the world, have problems with every day. You have got your high priority patients, which are the traumas, the codes, the MVAs, patients that are going to be needing multiple departments to care for them, versus the patients that are the lower priority, which is your sore throat, your ingrown toenails, your earaches, respiratory infections, problems like that that just needs one or two departments to care for their needs, and then they get discharged home with a prescription. In emergency rooms, they can go from idle and unoccupied to insane and massively crazy within just a couple minutes. So when something like that comes in, all of the staff focuses on the higher priority patients than what they do the lower priority patients. The most serious cases come first, and then the ones that were ready to be discharged or just needed an x-ray read from the sprained ankle that they have, they're put on the lower end of the spectrum, and their wait has to be longer. So as far as what can be done, if you've ever worked in or an emergency room or been to an emergency room, you know how chaotic they can be. But if you've ever worked in them, you realize that it's all about efficiency. And staff is constantly challenged to reduce the waits and the delays, but sometimes they can't do anything about it. So what Lake Cumberland decided to do is to implement a fast track, which basically means that you get the lower priority patients their own little area with a devoted nurse. They have two exam rooms that are devoted to that fast track area. They have one nurse, and they have either a nurse practitioner or a physician's assistant that is just dedicated to that area. So then what happens is all of the higher priority patients that come in get all of the attention that they're needed, and then the fast track or lower priority patients can come in, get what they need, and they get out quicker. For the QSEN, the QSEN for my paper, the two things that I focused on was patient-centered care, and as a result of this, the staff at Lake Cumberland knew that they were not giving their patients the attention that they deserved, so they wanted to start this dedicated area for the fast track. And then I also focused on the quality improvement and safety. And by improving the times that was given to the patients, the different patients, they improved the safety and quality of care that each patient received. And this fast track, whenever it was first implemented, they started it at 3 p.m. and it goes until 11 o'clock at night, which tends to be the highest, the most busiest times of the day for any emergency room. And it was initially started in September of 2015, this year, and the average time to triage was 11.6 minutes with a goal of 10 minutes. So then they implemented this fast track, and the first month, a marked improvement of 13% of the patients was rerouted to the fast track area, and the length of stay in the emergency room for most of the patients went from 195 minutes to a length of stay of 85 minutes. and the triage time decreased to 8.7 minutes, which was well under the 10-minute mark that they had strived for. And this was just the pilot month. Then, in October, the numbers started looking even better, and out of the 3,400 patients that were seen, 427 of them were rerouted to the fast track area, which is 12.5%, and the times reduced again to 8 minutes in the triage area from the initial 11.5 minutes. Then the fast track time also reduced to 76 minutes again from the original 117 or so odd minutes, which again improved patient satisfaction, patient care quality. And the first half of November, nearly 14% of the patients were rerouted to the fast track area, which is with a decreased time of 74 minutes in triage. And knowing that this is something that many hospitals around the country has tried to implement, established emergency departments with these fast tracks have times that range from 48 minutes to 134 minutes. Well, just in the first 3 months that this fast track was implemented at Lake Cumberland, the fast track times ranged from 40 minutes to 158 minutes, which is just outside those ranges. So we're right on track to where it needs to be. In conclusion, the introduction of the fast track at Lake Cumberland has definitely reduced the length of stay in both areas, the fast track and the main emergency room, which has increased patient care, patient quality of care, and satisfaction, patient satisfaction. Allowing this dedicated staff to focus on their patients has allowed the wait times to decrease greatly, so these patients that have been sick, that don't really feel like being there, get in and get out and get back home and on their way to recovery quicker. And the traumas and the patients that are higher priority emergencies actually get better care because they have more staff that are dedicated to them. And as a result of this first few months, the management has decided that next month they will be actually increasing the time of the hours for the fast track from the 3 to 11 that it is right now to the 1 to 11. So they're going to increase it by 2 hours. I'm actually kind of anxious to see what kind of results that gives us. So based on this data and how everything continues to improve each month, especially with the hours in the fast track, I think this was the right decision for Lake Cumberland, which will be the right decision for, I'm sure, many hospitals if they were able to implement something like this into their facility. Thank you.